All right, keeping it pushing. Back here, Big D Energy, Woodward Sports Network. It is time for our Injury Insider. That is right. Dr. Jeff Pierce from the Michigan Sports and Spine Center. He has brought a guest here today as well. But Dr. Pierce, appreciate you joining us as you always do. Also like to welcome in Tara Thiel. She's a vice president of business development for MetaLodge. More on them in just a second. But Dr. Pierce, as always, good to talk with you. And before we talk to Tara, calm me down on this. I told you it was coming before. I saw you walk in the door. Kerry Carpenter, fractured lumbar. He'll be out 3 weeks, 4 weeks. There's been a setback. We'll tell you about it later. I don't like what I'm hearing. Calm me down a little bit here. You did the first time. Calm me down again.
Yeah, like I said before, I needed to know the details. And because it's going out further, maybe the secret sauce, or they haven't given the secret sauce that we always refer to, is that he's having complications, which means he still has that instability. Because it's his spine, he's got all that rotational stuff. I mean, if he's feeling a tweak, it's not worth this time of the season to bring him back prematurely. So he's got to be coming back 100%. It's zero pain 100%. Normally I'll say zero pain 90%. With this part of the season, I think we're at all-star break here. We're midway. He's going to make a difference for the run. So I think I want to be that they're being overly cautious.
Okay.
And making sure we don't need to rush this. There's no reason to rush it. It's not like we're fighting for playoffs. They're doing pretty well right now. They're actually got a good run going. So there's, it's kind of like what's his face in Boston. We're doing okay without you. Keep sitting down.
Okay. All right, Doc.
But I would like to see him get some secret sauce. I mean, I love the biologics for stuff like this. Some of it for the mainstream guys, they don't see it. They got to kind of go in the back room to get it sometimes.
Okay. All right. I'll defer to you on this. You are the injury insider, so I'm calmed down a little bit more. No, but you did bring a guest here, as we said. Tara Thiel here is the vice president of business development for MetaLodge. And Doc, look, I was on the golf course yesterday playing with a good buddy of mine, Tony Paul from the Detroit News, and I was lamenting the fact that, speaking of spine and twisting and all that kind of stuff, I can't quite do that like I used to. And we got in a discussion about getting older and things like that. And, that whole process, through medicine obviously has changed, but there's another side of that whole prospect that people talk about, long-term care and what happens, as you kind of get towards the end of the road. I'm fascinated to have this discussion today. Tell us a little more about Tara and why she's here.
So Tara's here. We're working with, Michigan Sports and Spine has multiple things. People knows me as Doc Rock or the Injury Insider and stuff like that. We have a whole nother side of our company that I felt from a personal level needs to elevate, right? So in subacute, post-acute care, nursing home, whatever we're calling it, we're leaving the hospital, our loved ones leaving the hospital, and they have to go to like a nursing home. The theory of going to the nursing home and passing away and being done is long gone. Some people still have that mental picture, but the elevation of the care from a rehab standpoint, when you see the facilities, they now say skilled facilities with rehabilitation, meaning people are going there to rehab to go back home. I make fun of my old players. I'm old enough to
there may be one here, right?
No. See, I'm different because I'm special because I'm like Benjamin Button, and
he's getting younger as we go.
The story back to where we're talking stem cells and whatever. I put those puppies away 10 years ago with you,
right.
So I'm only going to get better. It's for the rest of them that aren't on the doc program, but it's great to hear because I was going to say, Drapes is getting up there, and
he was scared to get that needle.
Oh, yeah, petrified.
He will not.
Petrified.
Well, we can talk about that later. But really, the real subject and the reason I wanted Tara, because she is vice president of business development. So she's seen the changes. She's elevated in her career. She oversees multiple states. But the change is different. Like we're moving to Ohio and Tennessee. We work well together in Michigan. But it's that care that we have to guarantee the person. When you leave the hospital, you have choices now. The insurance, I won't get on my soapbox, but they're forcing the issue prematurely out of the hospital. So it means you got to choose to go home, go to inpatient rehab, or go to a subacute, post-acute care. Majority of these people are getting pushed into post-acute care prematurely, so that's forcing the Medilodge group or all the nursing homes to elevate their care to care for these people, because they get penalized if they get or readmitted to the hospital because they're prematurely discharged, which is the case more than we want to see. So they've come together and working with multiple specialists, not just rehab. So to give us a little idea of, they're now the largest provider in the state of Michigan.
We are. We have 51 locations throughout the state, amongst some other management agreements where we're supporting other providers that may not necessarily be called Medilodge per se. So at this point, about 1 out of every 4 skilled nursing facilities we're supporting. And I partner with Dr. Pierce and some others because, like you mentioned, the industry's just changed drastically. I've been doing this for about 15 years, and it was a whole nother, way of doing things 15 years ago, even 7-8 years ago, just pre-COVID. And then COVID kind of really brought a lot of challenges and a lot of, I think myths as well about who we are and what we do. And so Dr. Pierce and I and other physician providers out there who know the importance of a good 2 to 3 week, just aggressive therapy post a stroke, post an injury, post, an illness, what we can do to get folks back to healthy home level.
And the thing is, when we work together like that, we're fighting the insurance company. Like
every second of the day. Yeah.
15 years ago, we would have a stay, just to give you a clean example, in the nursing home up to 40 to 60 to 90 days being paid. Now it's down to 17 days. We're not that much better. There's not that much secret sauce. So when we have someone that we work with on the same page, like Medilodge is pro-patient. We're all advocates for the patient. What's better for functional outcome? We're always talking, like functional outcome you'll hear a ton of. And we fight with the insurance company for the nursing home to provide that extra care. So by having rehab and other like cardiology, wound care, you have to have every specialty that you have in the hospital. So a lot of the nursing homes are fighting to work as a mini hospital within that range. And Medilodge, there are bigger pictures, so they can do things like from a big corporate standpoint to bring in specialists like me to help their whole corporate model. So when you're out there deciding for your loved one, Medilodge is a great choice. You need to go visit it. I'm educating the nursing homes on how to promote themselves. A lot of them didn't have websites. They don't, they realized all they would get was negative feedback, so their ratings would go down. All that's changed now just in the last 3 years. You guys are much more aware of what the social media is saying.
Yeah, absolutely.
Well, that's why we're here today.
Speaking of that in the chat right now, the insurance companies are taking some shots right now in the chat. There is no doubt about that. But my main question is, because before you walked in this door, I had no idea that this industry had gone in that direction. And Dr. Pierce, look, this is going to sound cold, but this is, to me, it was still exactly what you said, where you get into your post-care, you go into the home. You go into the home and you just wait for nature to run its course.
I think you and majority of anyone else.
I'm just being honest.
Absolutely.
You know what I'm saying? I'm stunned. What brought this about? What brought this change in perspective in that whole industry about? Because I am fascinated. And again, my parents are getting older and stuff like that. Like, it's on the horizon. I'm just being real with it. So what brought that whole change in philosophy?
I think that for us, Medilodge, at least in our philosophy on it, is we put our resident, or our patient at the center of every decision we make. And I think it's important. We have to have folks like myself who, I'm an advocate. I'm an advocate for my residents. I'm an advocate for patients that just need that post-acute care.
That's what it all comes back to every time.
Yeah, absolutely. Or who may need long-term care with us. That's great too, that we do that. But I think we have to advocate for all that we do and make sure that, our society sees the positive and not just the negative, because generally that's what they see and what holds true if we're not out there advocating.
And they're under struggles too. Right? There's cuts everywhere. You keep hearing about Medicare cuts, or, Medicare's not paying, or what are we going to do? We're going to run out of money. Their dollar amount, what they have to do now with the amount of people, like especially COVID, like nursing homes are getting a lot of bad press right now because, look at the ratios of people. Well, nobody wants to work anymore. They don't want those ratios, but Medilodge has a reputation that people like to work for them. So their ratios are a little bit better. But some of these nursing homes, like I defend the nursing home, you get the state walking in, well, you didn't have enough people. Well, we can't hire enough people because someone gave away all this money for these people to stay home. So people don't want to work and do this type of thing. So it's a double-edged sword that we need to find a common ground. And by working together and communicating, having a common goal, like I say, we're all in the same canoe going upstream, but we're all together pushing. We're getting a much better result. And who's most important? I mean, like everything I've done, like when I teach my residents or my fellows or my medical students, I'm like, you do good medicine, everything's going to happen, right? You do what's right for the patient, everything's going to work out at the end of the day. You hear all these horror stories that get into the press, but you don't hear the heroes of really the woman that, falls out of bed or had a stroke, the people that are involved in it. I mean, you have a severe stroke and you get 14 days from an insurance company. Who's the cold one here? I mean, I can't get up.
No, I know. Hey, you're playing to the crowd, though. No, you're absolutely playing to the crowd.
But to your point, Medilodge was Employer of the Year, voted through Michigan Works this year as well. So we make sure that we're putting everything back into the care of the resident at the bedside with our staff. Any equipment they need. We have ventilator care units for those types of patients coming off of severe respiratory illnesses and that sort of thing. So, and working with cardiologists, pulmonologists, Dr. Pierce and his team, we have a lot more resources working together.
We need a lot more resources.
We need more.
But I think it really goes back to philosophy. It's being pushed out of that hospital quickly. I mean, when I was in the hospital, before some of you were born, but we had everything. You were there for days. We did. Oh my God, I forgot the old Red Wing. I took care of him. He had his stroke, and basically we had him there for 30, 40 days. Now we get called at day 7, the progress. Are they making? I mean, it's like the paperwork and the defense you have to do is taking away from patient care. I mean, I want to do a show like just about that, like how the system's broken, the suggestions we need to fix it. But right now, I mean, they have a very good system. So they're a larger company that can bring in better technology, better accountings of what's going on to give these insurance companies to push back. And now teaming up with our system, we push back because we speak the same language and we speak it better than them, than that that person that's working hourly. You didn't fill out all the boxes, therefore they have to be leaving. And the burden's on the family. I don't like culturally, there's certain cultures that want to bring in the family, but that disrupts, your kids going to sports and, we got to take care. There's just I'll peel back and shut up.
All right, Dr. Pierce here, as always, our injury insider every Tuesday. Brought along a special guest. It is Tara Thiel. She's the vice president of Medilodge, our vice president of business development for Medilodge. So Tara, I guess before we ride out here, where can people find out more, I guess is the question, because I'll tell you this again. Sure. I did not know before you walked in this door today. It is something I think that I would have to do due diligence on if I'm ever in that situation, for sure, 100%. Where can we find out more info?
That means I'm doing my job,
100%.
Just creating awareness and bringing the positive to what we do and how we can help you and your loved ones. And so medilodge.com is the best way. It's got all of our locations. We have a blog about who we are, what we do, the different services, and that sort of thing. So we have social media pages, Facebook, Instagram. Like you mentioned, everybody's got to be out there. So medilodge.com would be the best way.
All right. Well, I appreciate you. Anything else you need? Yeah.
No, I think this is good discussion. I appreciate it.
No, absolutely. I can tell with you, like it's organic. Like, again, you talked about advocate. People that are sick need advocates, and it's unfortunate that that's what it is right now, but that is what it is right now.
It is, and I think I grew up taking care of my grandparents and my parents and all of that, and just need more folks like myself and Dr. Pierce and others in between to continue to advocate and show what we're able to do.
So when Darren is ready, he'll have a clean shot into the right place.
Yeah. Well, yeah. I mean, do you put him through a table again? I
put a guy through a table last night. I didn't go through the table. So
when's the last time you went through a table, D-Mac?
It's been a while. As far as you know.
See, that's education. I told him these are the things we got to cut out.
There you go. See, he listens.
But it goes down to don't tell me what, tell me who. And you have to go out. And it's unfortunately, like anything else, there are bad in this world, but they're also good. And the thing is teaming up together, like Doc said, the compassionate ones. So do your due diligence. And unfortunately, if you're in a situation or family members that aren't in the optimal situation, then reach out to Medilodge or so you got to do your due diligence, because you brought up his spectacular point. We joke a lot about, us and our age and the wings and stuff like that, but our parents. I mean, that's where we're at it right now is like my mom's 75 and these are the questions. So whether it's if something happens, where do you go for the post care or what's the next transition? Because it's not the end, right? It's
That's
not
right.
the death sentence. It's not the end. It's actually just to enhance. And I just think the way that medication is, and it's got to start from the compassion. So not just talking about it, then being about it, but if you're out there, go do your due diligence.
That's right. And there's people like me out there who have lived and breathed this their whole life. It's all I know. I can come and talk sports and I'll listen. I probably won't be great, but this is my passion and what I do and what I know. And there's lots of people like me out there that will help you and your loved ones through the process with support and help you out. So
it shows when you talk, and appreciate you guys stopping by. Thanks, Dr. Pierce, for setting it up.
All right.
We'll talk again.
We'll talk more about your Tigers later.
Yeah. We certainly will.
Attention sports fans, don't miss out on Expert Sports Injury Insight with Dr. Jeff Pierce of Michigan Sports and Spine. Join Dr. Pierce every Tuesday during Big D Energy and Thursdays during Ermanni and Edwards, where he offers top-notch injury advice. Trust the guy that I trust. Dr. Jeff Pierce is here to keep you in the game and performing at your best. For more information, visit MichiganSportsandSpine.com or call 248-426-9944.